Hello, everybody. Welcome to tonight's episode of Navigator Nuggets. I am your host, Dr. Nicole Rochester, founder and CEO of Your GPS Doc. I am excited to be here with you all today for another episode of Navigator Nuggets. Thank you for taking the time to be with me tonight. If you are here, just drop in the comments, say hello, so I know that you are here and I can properly acknowledge you. Hi, Uncle Richard. Hi, Dr. Jatu. Dr. Jatu, it's great to see you. I have been meaning to reach out to you. Good to see you. So, you all, here we are again, still in the middle of this coronavirus pandemic. And hi, Betty. Nice to see you. Hi, Adrian. You all, I am struggling because, like I've mentioned before, how to navigate the healthcare system. So when I'm talking to you all on Navigator Nuggets, I'm talking with you about how to navigate what you need during the coronavirus pandemic. Hey, Deneen, thanks for tuning in. So tonight I want to talk about testing. I have gotten a lot of questions about testing. It comes up a lot in not only in my personal Facebook groups, but also some of my professional Facebook groups. I have some friends who have had some challenges, either with themselves or with their family members, with getting tested. We talked in previous episodes about some of the health disparities and how that is impacting testing. So I thought it was an important enough topic that I wanted to talk about that tonight. So that's what we're going to focus on tonight. So if you all have any questions about testing for COVID-19, feel free to drop those in the comments. For those of you who are catching this on the replay or on my YouTube channel, welcome to you as well. All right, so as of today, which is Monday, May 11th, 2020, at 8:07 p.m., I am going to start by just sharing the statistics. So globally, there are 4,171,859 cases of COVID-19. This is globally. 285,690 deaths. And in the U.S., we are now over 1 million, as you probably are aware. So 1,346,723 cases and 80,352 deaths. So, again, in light of the fact that we're talking about testing, you all know that when I tell you that we're at 1,346,723 positive confirmed COVID-19 cases in the U.S., you almost have to take that with a grain of salt, because we know that there are many, many, many asymptomatic people walking around with COVID-19 who are not going to be, who have not been tested, who won't be tested, many of whom will never know that they even have it. And we know that there are symptomatic people with COVID-19 who, for a variety of reasons, have not yet been tested. Many of them will never be tested. So when we see these numbers, or when you see the numbers jump up in your own county or in your city or your state, you need to understand that a lot of that is just due to a ramping up of testing. But you also need to know that in the United States, we are still doing a piss poor job related to testing. We still don't have adequate testing supplies throughout the U.S. So we are never going to really know how many people have COVID-19, at least not during this first wave, in my opinion. So Betty asked, should everyone be tested? So Betty, I will answer that a little bit later. And if I forget, please type it in again to remind me. But I'm going to do my best to remember that, because that's a very, very good question. Betty says, my city is off the hook. My zip is the highest for my town. Wow. Yeah, Betty. And I live in Maryland. I live in Prince George's County, Maryland. And unfortunately, my county is leading in terms of the number of COVID cases in the state of Maryland. So I can relate to that. And while my individual zip code is not the highest, I live very close to some of the zip codes that are testing, that have the highest rate. So that's why I have been keeping my little behind in my house as much as possible. And I am only going out for essential things, basically grocery shopping. And I have gotten that down to a science. Hi, Ruby. Thanks for joining. And Betty says she's in New Jersey. And also, you want to know, if you have it, should you be retested? Great questions, and we are going to talk about all of that. All right, so let's go ahead and get started. Right now, like I said, we're in the midst of the pandemic, and many people who are having symptoms of COVID-19 are finding that they are not able to get tested, and that can cause a lot of angst. That can cause frustration, particularly if you are someone who has underlying health conditions, or if you are someone who maybe you're caring for someone with an underlying health condition, and maybe you're just having, a few minor symptoms, but you just want to know, because that will impact how you provide care to a sick family member or to a family member in need. So it really is a big issue. And in an ideal world, we would have enough testing kits such that everybody could be tested, both symptomatic and asymptomatic, right? Because we know that you can have absolutely no symptoms and you can be infected and you can indeed pass this virus on to others. And we know that that's a significant part of why the virus is continuing to, circulate in our community. So that's an ideal world. We are not in an ideal world. A step down from that would at least be to test all of the symptomatic people, right? But we're not even there yet. We're not even at a point where we can test every person who is symptomatic. So I want to talk about, how do you get a test? If you are having symptoms and you are concerned that you may have been infected, or maybe you were exposed to someone with known coronavirus and you are wanting to get a test, what do you have to do? Well, the first thing you need to know is that generally in all the states, you need to have a physician's order, okay? So what that means is that you either have to have some type of relationship with a primary care doctor or a specialist who is willing to enter that order, or you will have to be seen in a medical setting like an urgent care center or an emergency department, where the physician seeing you there or the healthcare provider will enter an order. Every state is a little bit different. The CDC has issued some guidelines, and I'm going to talk with you all about some of that. So they have issued some guidelines to healthcare providers and to the lay public about, who should be tested and who should be prioritized. And we are having to prioritize testing. Why? Because again, we do not have enough test kits. So because of that, there are algorithms that the doctors and the other healthcare providers are following to even determine who can get a test. So you have to have a physician's order. Now, as I mentioned, the CDC has issued guidelines, but as you all probably have seen, your own individual state, you have governors, you have your own, health professionals, and every state has their own health department. Counties have their own health departments. So, this type of thing, these types of decisions are largely being made on a state-by-state basis. And the decisions are being made based on, their capacity to test. And so there are some states who may have tons of testing. There are some states who may not have been hit yet by COVID-19. And so they may have an actual excess of supply. And then there are other states and hotspots where they can't get enough tests no matter what they do. I have a physician friend who is a pediatrician, and she has posted several times in our physician Facebook groups asking about tests. She has a private practice here in Maryland, and she has ordered tests on a couple of these, from some private labs, and they haven't come. And she's been waiting for 2 weeks, and the lab keeps giving her the runaround about when the tests are going to be here. And then at one point she said they canceled her order altogether, so she had to reorder. So what I'm telling you is that even the doctors are having difficulty getting these tests. And they're being prioritized. And so depending on where you live, depending on who your doctor is, you may or may not be able to get a coronavirus test, even if you are actively having symptoms. Hey, Carla, thanks for joining us. So if you are having symptoms, like I said, you have to have a doctor's order. So the first piece of advice that I would give you is that you need to contact your doctor. Okay, hopefully you have a primary care doctor. Contact that doctor. They have guidance, again, issued by the state that will inform them as to, whether or not you will get a test. And they will, of course, go through your symptoms and ask you questions about, the symptoms that you're having. And then based on these algorithms, they will determine whether you meet the criteria to be tested. And if they determine that you do, then they will issue an order. Now, how the order goes in and what happens next depends on your state. So I'll just talk briefly about Maryland because that's where I live. And that's where, I'm intimately or somewhat intimately familiar with Maryland's process. So in Maryland, there's kind of multiple processes going on. Like I mentioned, private doctor's offices may have the ability to test in their office if they have ordered test kits and received test kits and received, kind of a waiver to be able to do that testing in their office. Otherwise, they may order a test for you to go somewhere else to be tested. So here in Maryland, we have, some freestanding testing sites. We have drive-up testing sites. We have some sites that are being done at where you would get your vehicle emissions test. They have turned some of those sites into COVID-19 testing sites. And in those cases, it's done through what's something called CRISP, which is our regional information processing system. It's basically like a regional electronic medical record. So for some of our sites, the doctor has to order the test in this regional electronic medical record. And then what happens is you receive via email a testing code and a link to the location of the sites. And then you have to book your appointment online and you enter this code that you were given. And then in other places, you can go to the drive-up site, but you still have to have a physician's order. So that generally is being delivered via email. So when you get there, you have to show evidence that you have a doctor's order. And I'm not going to go into all the, we're not going to talk about health disparities today, but you can imagine how this is a significant barrier because, of course, we know that many people don't have primary care doctors. And so that's already a barrier at the beginning of the process. You cannot just show up and say, I'm having a fever, I'm having a cough, I'm having shortness of breath, I want to be tested. You have to have a physician's order before showing up at these sites. Now, if you don't have a primary care doctor or a specialist who is able to order the COVID-19 testing for you, then most states, including my home state of Maryland, has you can go through your health department. So I would encourage you or your family members, if you don't have a regular doctor, to contact your state's health department. You can Google it, Maryland Health Department, DC Health Department, Texas Health Department. You can Google your county health department and you will find, the email address, you will find phone numbers, and you can contact them. Many of them are doing testing on site. And so many of them are doing screening where you can show up typically by appointment. They will screen you and ask you questions. And then if you meet the criteria, then, they will proceed with an order. So that's something that I think is important for you all to know. The other thing I want you to know about testing is that there are two different types of tests. And I don't want you to get confused when you're hearing about tests. So there are tests that are looking for acute infection, meaning you are infected right now. And those tests are either looking at RNA particles, and don't worry about the technicality, but this is an RNA virus. The coronavirus is an RNA virus. So they are actually looking at genetic material for the virus. And there's another test that looks for proteins. Both of those tests are looking to see, are you currently infected with the coronavirus, okay? And the test, as you all may know, is a swab. It's a nasopharyngeal swab that I'm told is a really, really long stick. Hey, Dr. Terry, thanks for watching. And this stick goes, it's not just in your nose, it goes all the way in your nose. And basically your nasal pharynx is like, it goes into your throat. And I'm not saying this to scare you, because if you need to be tested, then you need to have this test, okay? But it is unpleasant. And, if it doesn't make you gag and if your eyes aren't watering by the time it's over, then they haven't done it correctly, okay? So that's the majority of the testing that is being done, particularly if you go to one of the testing sites, if you go to an urgent care, or if you go to an emergency department, okay? So those tests are looking to see, are you currently infected? Now, there are some at-home tests that they've been talking about with saliva, or that you can just put in your nose yourself. My research as of earlier this afternoon is telling me that the FDA has not formally yet has not yet formally approved any of these home testing kits, but they are being produced, and I'm sure in the very near future they will be made more readily available. Personally, as a physician, I'm a little leery about tests that utilize a swab in the nose or saliva. I would really want to hear more about the sensitivity, which is how well they're able to detect the virus, and the specificity, which means if you get a positive, can you believe that? What we know already from the tests is that we're getting some false negatives. What that means is that the sensitivity, the ability to detect disease when present, is not great. It's not 100%. So some, I've heard 20%, I've heard 25%, I've heard up to 30% false negative, meaning you could have symptoms, you could go get this test, your test could come back negative, and you could still be infected with the coronavirus, particularly if the technique wasn't appropriate, if the test wasn't done properly, or if the reagent wasn't, what they use to mix the sample with, if that wasn't done properly. There's a whole host of things that can go wrong that can yield an inaccurate result, okay? So you also need to know that the test result that you get may or may not be accurate. Now, if you get a positive test result, because of the specificity of these tests, we believe that. If you test positive, likely you have coronavirus. But if you test negative, you may not have coronavirus, but you may actually have coronavirus. So that is actually the viral test. Then there are antibody tests. You guys have probably been hearing more about antibody tests. So what happens is when you are infected with a virus, as you are recovering, part of the way that your body fights that virus is to make antibodies. These are, chemicals in your body that basically fight the virus. And so what they can do is they can measure those in your blood. So that is a blood test. And that lets them know, do you have antibodies circulating in your blood that show that you were infected with the coronavirus? So these antibodies can start to show up while you are still sick, while you are still contagious. But even after you have recovered from the coronavirus, these antibodies are detected. And so you probably have heard, they're starting to do more and more antibody testing because, and particularly with research and some of the trials, because they want to get a better idea about how many people have already been infected. They are really curious about people who have never had symptoms and yet have antibodies to the coronavirus. So you may be seeing solicitations about, participating in some of the clinical trials for people who have not had any coronavirus symptoms, but they're wanting to see if indeed you are infected. And moving forward, we're not quite there yet, but moving forward, I think antibody testing will have a bigger role in terms of, phases and opening up states. But what you need to know, and what really saddened me, is that even if you have antibodies to the coronavirus, meaning you have already been infected, what we don't yet know is, what does that mean? And there is evidence to support or to suggest that you can be reinfected with the coronavirus. So, I would love to believe that if I've already had it and didn't know it, or had it and had a mild case, I'm out of the woods and I'm done. But we don't think that that's the case. We don't really know. So there's still a lot of unknowns. All right. So going back to Betty's question earlier, she said, who should be tested? And so right now, because of the decreased supply, they are actually prioritizing testing for coronavirus. And in terms of, who's being prioritized for that, at the end of the day, healthcare providers are absolutely at the top of the list because, they are coming in contact with sick individuals every day. And so it's really important that we know whether our healthcare providers are infected so that they can be properly, removed from the workforce temporarily and, quarantined and isolated at home. So we do know that healthcare providers are being prioritized. Also, people are being prioritized. Hospitalized patients are being prioritized. So anyone who is in the hospital who is having symptoms, they are absolutely being prioritized. But many hospitals, or some hospitals, are actually starting to test all patients with coronavirus. Again, this depends on how many tests they have available to them. Okay. So those people are being prioritized. And then the third group of patients that are being prioritized are residents of long-term care facilities. We're talking about your nursing homes, your assisted living facilities. So you all know that, this is just devastating, these long-term care facilities for many reasons, which we've talked about in a previous episode of Navigator Nuggets. So, these facilities are starting to test definitely their symptomatic residents, but many of them would like the ability to test all of their residents and, of course, their staff, their workers, because again, they need to do their best to prevent this virus from entering the facility. And then once it's there, they need to be able to isolate the residents of these facilities who are already infected. Okay. So having said that, if you are someone who has mild symptoms, if you are not, needing to be hospitalized, if you are not severely short of breath, if you are able to manage your symptoms at home, then I'm not going to say you shouldn't be tested, because of course you still want to know, but depending on, where you present for care, depending on the supply, you may or may not be tested. But if you are sicker, if you are in these categories that I already talked about, if you have significant underlying health problems like diabetes or heart disease or high blood pressure or asthma, then you are more likely to be prioritized for testing because of the fact that you are more at risk for severe disease. Okay. So again, these decisions are being made, by the doctors, and they are being guided by the state and by algorithms. So I really can't tell you whether or not you should be tested. What I will tell you is that if you're concerned, you need to contact your healthcare professional or contact your state's health department, and they will go through the screening process. There is actually a self-checker on the CDC website, and I'm going to drop these links after I am done. So there is a self-checker that you can basically click that, and it goes through questions. Now, they say on this website that they're not saving your health information. Again, I'm just the messenger. That's what they say. So hopefully that is true. But there is a self-checker site where you can basically click, and they'll say, are you having this? Are you having that? You click through the symptoms that you're having, and then they will recommend, based on your symptom checker, whether or not you should go get tested. Hi, Lolita. Hi, Jan. Thank you both for joining. All right. So, Betty, I hope that answers your question. And then Betty wanted to know, should you be retested if you have already had COVID-19? So, again, I always recommend that you all, I cannot provide medical advice in this venue. This is for informational purposes only. You always want to ask your personal physician. I think in general, what we know is that, you can test positive, they think, even for weeks after you have been initially infected. And so right now, they're not generally recommending that people get repeat testing to see if they are now negative. There is separate guidance related to individuals who have already been infected with coronavirus about when they can return to work, when they can come out of self-quarantine. So I would encourage you to go to the CDC website for that information. They talk about how long you've been without fever, how long it's been since your first symptoms appeared. So the CDC has all kinds of guidelines related to that. But generally, particularly because we don't have enough test kits available, I think it would be really difficult for you to, if you've been infected with COVID-19 and now you're well, to get a doctor to order a repeat test, unless you're part of some type of clinical trial or research study. All right. The last thing I want to talk about is payment, because a good friend of mine reached out to me recently to tell me that a family member of hers was told that they would have to pay for their testing. And so you all may know that there have been some laws that have been passed as a result of COVID-19, and one being the CARES Act. There's a lot of other things that came out of that, but there have been laws that have been passed to address the healthcare costs associated with COVID-19. And one of those laws dictated that insurance companies would not charge for COVID-19 testing. Okay. So that is what they said. And you guys notice I keep saying that is what they said because, I'm not a conspiracy theorist or anything like that, but I have seen enough over the last 2 months to let me know that, we just can't trust everybody. Let's just leave it at that. So by law, the COVID-19 testing is supposed to be free. And the wording basically says that insurance companies are not supposed to charge you for COVID-19 testing, okay? Now, some of the pitfalls in that are that some people have gone to their doctor or they've had a telemedicine visit, and if the doctor does not order the COVID-19 testing, then they are being charged. So maybe their original purpose was to get the test, but maybe after being seen or either remotely or in person, maybe the doctor decided, we're not going to do the COVID-19 testing today. I'm going to test you for the flu. I'm going to test you for some other things. And then if these things come back negative and if you're not feeling better in a few days, then we'll do COVID-19 testing. Well, if that COVID-19 test was not ordered during that visit, then yes, you are going to be charged for that visit. Because in addition to testing, some insurance companies have said not only are they not going to charge you for the test, but they're not going to charge you for care received that was related to COVID-19 testing. So I hope that I'm not confusing you all. So the issue is if you are being seen for COVID-19 symptoms, but an actual COVID-19 test is not ordered, then that visit is exempt from these provisions. And yes, you absolutely will get a bill for that, based on whatever your arrangements are with your insurance company. But some people are saying they're being charged for the tests. Now, why is that? In some cases, the doctor is not coding it properly. So if you get a COVID-19 test and you get a bill for that test, one of the first things you should do is to contact the insurance company and find out why you were billed, find out, was it coded as a COVID-19 visit or concern for COVID-19? If not, then you can call your doctor and let them know that the visit was not coded properly. And hopefully with those phone calls, the doctor will go back and modify what he or she coded for that visit, and then it will be covered. But in other cases, what's happening is that it's something called balance billing. So some of the labs are, the insurance company was told that they can't charge, but the labs can absolutely charge for the test. So let's just give you a quick example. This lab charges $150 for a COVID-19 testing. But let's say your insurance company only allows $75, okay? So the lab is charging $150. Your insurance company only allows $75. So your insurance company, based on your benefits, is going to make it free to you, but they're going to only pay that $75 that they allow. Now, the lab may then bill you for the additional $75 that your insurance company didn't cover. That's called balance billing. And in some states, it is not allowed. It is illegal. In other states, it is allowed. Depending on what type of insurance product you have, it may or may not be allowed. So, or if the testing was done at an out-of-network lab, then you may find yourself being subject to additional charges. And we've talked about out-of-network and surprise billing in previous episodes of Navigator Nuggets. So the short answer is that while it was supposed to be free, I am hearing from people and I am reading articles that show that some people are being charged. So you guys know I always tell you to be your best advocate. So if you are getting charged for a COVID-19 test, make yourself familiar with the CARES Act and the other laws that have been passed. Call up your insurance company, ask why you were being charged, communicate with the doctor's office, make sure that it was coded properly, and fight your case, argue your case, do an appeal if you have to. And in many of those cases, the charges are being reversed, okay? Let me know if you all have any other questions about COVID-19 testing. We're right at about 30 minutes. I don't want to go much longer because I want to be respectful of your time. And if I don't answer your question while we are live, I always go back and answer those questions. So I will be sure to do that. Hi, DR. Thanks for tuning in. All right, you all. So I will continue to look for your questions, but I am going to wrap up this episode of Navigator Nuggets. As always, thank you all for tuning in. We do this every Monday night at 8 o'clock p.m. Eastern Standard Time on my Facebook page, the Your GPS Doc Facebook page. And then these episodes are available afterwards on Facebook, but also on my YouTube channel. So you can go to bit.ly/YouTube GPS Doc. If you want to see these, I encourage you to subscribe to my YouTube channel. It's much easier to navigate over there. You can scroll through all the previous episodes, and it's much easier to find them on YouTube because that's all that's there are my videos, okay? Betty says, we have sites for people with insurance and sites without insurance paid by the city. Awesome, Betty. Yes, and in most states, if you don't have insurance, you can go through your health department and you should be able to get a free COVID-19 test. Betty says, thanks for the information. You're welcome, Betty, and thank you for the dialogue. Thank you for your great questions. You all, if you missed Navigator Nuggets a couple of weeks ago where I talked about navigating a hospital stay, or it may have been last week, I want to just reiterate, during these times, I mean, always it is important that you are intimately familiar with your health history and the health history of your loved ones, those in your household and those for whom you may be caring. But now more than ever, you need to have a document, a piece of paper with all of your pertinent medical information. I cannot tell you how many people I have heard from with horror stories during this coronavirus pandemic because their family members get sick. They have to take them to the ER. They are not allowed in the emergency room. They are not allowed in the hospital. And the family member is sick. When we are sick, we are not at our best. We are not going to remember everything, no matter how old you are. You are going to forget pertinent elements of your medical history. You may not remember all of your medications. And when there is a gap in that information that you provide to that medical team, that directly impacts their ability to care for you safely. So I mentioned it on the episode where we talked about what to do if you're hospitalized. I created a Navigator one sheet of paper, front and back, everything you need to document your medical history, your kids, your husband, your wife, your mom, your dad. Please go to the website that I'm about to tell you, download it. It's 100% free. All you have to do is give me your email. You will get this in your email. You can download it, you can print it, and you can fill this out. And I guarantee you this may save your life. And I'm not being dramatic here. It is very important that the doctors have the information that they need. They may not be able to talk to your primary care doctor or the person that knows you best. They may not be able to talk with your caregiver. They are busy, they are swamped, they are stressed, and things slip through the cracks on a regular day, let alone in the middle of a global pandemic. If you could walk into that ER, that hospital, that urgent care center, and hand them one sheet of paper, you don't know how helpful that'll be for the doctor, for the other members of the medical team, and most importantly, it will keep you and your family members safe. So go to bit.ly/GPS one sheet, okay? bit.ly/GPS one sheet, and get your Navigator one sheet today. Please share that link with your friends, your family members. Again, it's free. I'm not asking for any money. I just want you all to be safe, okay? So I'm going to end with that. Be safe. Stay inside. I don't care what your governor said. Don't get your nails done. Don't get your hair done. Stay home as much as humanly possible. Keep washing your hands, covering your cough and sneezes, cleaning those high-touch areas in your home. I pray for you all every day. I pray that you stay safe, that your loved ones stay safe, and I will see you all next Monday night at 8 o'clock p.m. for the next episode of Navigator Nuggets. Take care, everybody.